Medicine evolves one story at a time. Here's one worth telling. This is History Taking. It's 1929. A 25-year-old intern is in the operating room alone, and he numbs his own arm. He decides to take a urinary catheter, the kind that we use for bladders, and he slides it into his vein at his elbow. He threads it up 60 centimeters up through his arm, through the chest, and into his own beating heart. And then he gets up, walks over to the x-ray department, takes a picture. And that x-ray shows a catheter tip that's sitting in the man's right atrium while he was fully awake. And it's one of the most iconic images and processes in the history of medicine. This man's name is Werner Forssmann. He was a first-year surgical intern at the time, and within weeks, he would be fired, humiliated, and effectively exiled from cardiology. And he spent the next 27 years as a small-town urologist, and then in 1956, someone called him. Cardiology back in 1929 is effectively a black box. You can listen, you can percuss, you can get an EKG, and you can take a chest x-ray. There's no way to measure the pressures inside the heart in real time. There's also no way to directly visualize these chambers, and therefore there's no way to deliver these drugs precisely. Cardiac emergencies are managed largely with guesswork and prayer and clinical intuition. And the specific gap that Forssmann is obsessed with is, what if you could actually get inside the heart while it was still beating? Not theoretically, but literally a tube or a wire or a window into the living heart. The heart at the time was considered untouchable. Not just metaphorically, literally. The prevailing belief was that any sort of direct mechanical interference with the heart would trigger a sort of fatal arrhythmia or some sort of rupture. You just don't go in there. Surgeons would not operate on hearts. The heart is where you stop and draw the line. This isn't a fringe superstition either. It's just the dominant consensus at the time among the leading surgeons in Europe. The heart is sacred ground. Medicine drew the line, and the line is the pericardium. Forssmann at the time is a 25-year-old intern, and he's in a provincial town outside Berlin and 1 year out of medical school, and he comes across this sketch in a physiology textbook that shows this long tube being threaded into a horse's jugular vein, guided into the heart, and measured the intracardiac pressure with a balloon. And his logic was, hey, the horse was able to tolerate it, and humans have veins too, and if you use the antecubital vein, which is pretty accessible and pretty forgiving, you could probably reach the right atrium without even going near the chest wall. Maybe after that, you could do pressure measurement, you could do direct drug delivery, you could do a real-time visualization of the chambers. The applications are huge for this. And so he brings the idea to his department chief, Richard Schneider, who tells him to test it in animals first. And Forssmann decides this is a waste of time and goes around him. Before we go further, it's important to note that Werner Forssmann was a complicated man. In 1932, he had joined the Nazi Party, which was a choice that, according to his daughter, haunted him for the rest of his life. And to his credit, he did refuse when offered a steady supply of human research subjects by one of Himmler's physicians, a man that was later executed in Nuremberg. He continued to treat Jewish patients when ordered not to. But the party membership was real. We're not going to skip over that. But this episode is more about what he discovered and not a celebration of those decisions. Medicine has always been made by imperfect people, and we can honor those discoveries and hold the person accountable at the same time for the mistakes that they made. But back to 1929, because what happens next is one of the most audacious things anyone has done in the name of science. So Forssmann enlists Gerda Ditzen, who's the OR nurse in charge of sterile supplies, and he needs her access, and she agrees, but only if he does it on her arm, not his own. That's too dangerous for the doctor. He agrees, and then restrains her to the operating table, proceeds to anesthetize her arm, and then quietly does it on himself. She realizes that the catheter isn't in her arm, it's already in his vein, and he tells her to call radiology. He didn't want to take the risk with her. He wanted to do it for himself. They walk downstairs together, and he watches the catheter advance in a mirror held up to the fluoroscope, 60 centimeters into the right atrium. The x-ray's taken, he's fully awake, his heart is beating normally, and the film shows the catheter tip just sitting in the right atrium. The heart, the supposedly untouchable heart, didn't seem to care. His boss is furious. He sees the x-ray and immediately grasps what just happened. And Forssmann is allowed to repeat that procedure on a terminally ill patient to deliver drugs directly, and it works. He publishes this in November 1929, and he was catheterized his own heart 6 more times just to test what happens. The paper ends up being published, and the European medical establishment largely ignores it until they start noticing it and things get worse. Forssmann is invited to the Charité in Berlin, which is the most prestigious academic hospital in Germany, to work under Ferdinand Sauerbruch, who's the most famous surgeon in the country at the time, and Sauerbruch learns what Forssmann did and fires him on the spot. His exact words were, "Capers of this sort are more suited to the circus than to a reputable German clinic." He was reinstated and dismissed again for failing to meet scientific expectations. Then he was accused of plagiarism accusations from a rival. These were never substantiated, but it's interesting that you're being accused of plagiarism for a study that seemed to be of such ill repute. But Forssmann was constantly just humiliated and out of options, and he had to leave cardiology. So he decided to become a urologist instead. Apparently he was a good one, but he was still a urologist and not a cardiologist, which is what he was training to do. So he serves as an army doctor through World War II and then becomes a prisoner of war. His 2-page paper sits largely unused in a German journal. While Forssmann is in a prisoner of war camp, his 1929 paper actually reaches New York. And Andre Frederick Cornon and Dickinson W. Richards, who are working at Bellevue Hospital, read it, and they see what the others missed. So they spent the 1940s trying to build on it, methodically measuring the cardiac output using the Fick principle, quantifying pressures across chambers, mapping the physiology of heart failure, shock, pulmonary disease, and by the early 1950s, cardiac catheterization is a clinical cornerstone in the United States. 1956, Forssmann is just a small-town urologist in Germany. His family is struggling financially, and then the call comes. It's the Nobel Prize Committee, and he shares his prize with Cornon and Richards. And in his memoir, he describes getting the news like a parish priest who suddenly became the Pope overnight. That circus man, Ferdinand Sauerbruch, who dismissed Forssmann, he had died in 1951, 5 years too early to see how badly he'd called it. Cardiac catheterization is now performed millions of times a year worldwide. A right heart catheterization measures pulmonary pressures, diagnoses and manages heart failure, evaluates transplant candidates, and titrates therapy in cardiogenic shock. Left heart catheterization is the foundation of coronary angiography, PCI, stent placement, and structural interventions like the MitraClip. Central venous access is huge too. The central line every intern places on their first week of wards traces back to Forssmann's demonstration that intravascular catheters can be safely advanced to the central circulation. The dogma that this heart is untouchable didn't fall because of some sort of grand multi-center trial or a committee consensus. It fell because a 25-year-old intern in a provincial German town had talked a nurse into restraining herself, numbed his own arm, and tested on himself, threading a urinary catheter 60 centimeters to his own heart. So next time you're in the ward and a patient rolls by for a cath, you can recognize that procedure in direct lineage, but begins in the fluoroscopy room in 1929. This has been History Taking. Thanks for listening. Want to talk about the latest episode or give us feedback on how to make the show better? Feel free to reach out on our Discord in the show notes below. Want to send support? Feel free to engage with our Patreon. This is just a passion project for us, but we're always looking for ways to make this better. Thanks for listening.